All right, it is my great pleasure to welcome everyone to the third and last day of Osmocosm 2, which is our second global distributed machine olfaction technologies conference at MIT, this October 22nd of 2022. We're coming to you live from MIT, and we are indebted and absolutely love the fact that we got sponsored by one of the world's preeminent companies in the world of olfaction called Aromex. We were very happy to receive Ilya Kolb's, Dr. Kolb's lecture yesterday. It's all going to be online and on YouTube on our website. All of our speakers' presentations have been recorded. You can watch them on the website. Aromex, I want to thank them for leading the world in expression of olfactory receptor systems. And they, I think, have the best chance of actually expressing the entire human palate than anyone else on the planet. I also would like to thank Tunable, our other sponsors, who have created a machine olfactor, a device that they call Olfaction Perfected, that has a very wide IR scanning window from a couple of microns all the way to 10 or more microns, where you can actually find signals in scent data that are difficult to find if you have a dedicated sensor. And it's a small device. I highly recommend you go check it out. We also are indebted to Bowman's Law Group from South Africa, who have sponsored students to come here and participate in the mood contest. Togas, curtains, and other interesting technologies and apparatus for the home, who have also sponsored students, and the University of Pretoria, who have sponsored students. This is the people who gave us the money to be able to do this, and these are the people who made it happen. This is a labor of love by everyone involved. It's all volunteer-based. It's non-profit. We created a non-profit. And if it was not for these people here, we would not be able to do this. So let me just thank them one by one. Nikhil Lal, who is an engineer at MIT, right here in the CBA, same place that I work in. Carolina Sulich, Professor Chris Rose of RISD fame, who will speak today, Litoya Nakopoulou, Michael Benson, Dimitrios Ioannidis, he's our treasurer, also instrumental to the operation of this, Lyndon Gladhill, A.L. Perry, Tara Scudder, our proper and resident anosmic, who we are studying, and M. Doherty, who is making sure that you guys can, we can all do this. So thank you all. Thank you to this organizing team. Without these people, we wouldn't have this. Thank you all for coming, whether it is online or in person. And for my next trick, I want to introduce to you the next speaker. But before I do this, I would like to, if Petra and Sol are ready. No, they're not ready. Okay, so tell me when they're ready. Put them up on the screen. So what we'll do is I'd like to introduce Claire Guest. Dr. Guest is the co-founder, or the founder, CEO, and chief scientist of Medical Detection Dogs UK. You'll see her in a minute. It's this person right here with whom I have the absolute honor and to have had a paper together where she's the first author and I'm the last author, where we trained dogs, or she trained dogs, and we trained artificial intelligence to mimic the dogs in the task of detecting prostate cancer from urine of patients without any... Aha, and there she is, Claire. I'm still introducing you, Claire. And because of the timing, I want to make sure that we have Petra and Sol in for 30 seconds before Claire starts talking. And no, they're not in? Well, they can only do it for 9:40. So with Claire up there, I want to say that I am just delighted that she has managed to join us today. I count her not just as a friend and colleague, but an absolute inspiration in the way that I do work and in the way that many people, including startups, financial visionaries who are funding the new generation of technologies that can sniff us and diagnose us without making any extra holes in our bodies. And all of this is inspired because it inspired me to do all these things because Claire published a paper in 2004 in the British Medical Journal where she described how a dog that was trained to detect bladder cancer in urine did very well, more than statistically allowable by chance, 3 times better. And but the dog kept making a mistake about this one person's urine that had been cleared by the hospital as being and then negative control. That means that person was cleared by the hospital of having bladder cancer, and then they donated the urine as the control, the decoy. So the dog kept making a mistake, saying that urine right there is actually from a person with bladder cancer. So that person, of course, got a little bit freaked out, and they started checking themselves. And a few months later, indeed, they had very early stage bladder cancer. So the dog knew something that the hospital couldn't find. So that told me that dogs can detect earlier. We already knew that dogs can detect faster, cheaper, better, more accurately than any other hospital technique if trained correctly and if you're trained long enough. The second thing that blew my mind is Claire's own story that she has published in a book called Daisy's Gift, where she describes how her own dog, Daisy, kept nudging her in the chest and alerted her to a breast cancer diagnosis that was later confirmed by doctors. And she's very upfront about this and very open about this, wrote a whole book about this, with doctors actually saying straight up that had it not been for the dog alerting early, this could have been a much different outcome. So do we have, yes, no, do we have a Simi to show? There she is, Simi. Make her into allowed to talk and allowed to show. Yes. So, oh, good. Do we have? Can we have her face up, please? So, before we go into Claire's talk, I want to entertain and delight you, I hope, with my kids who are very curious, and they've been bugging me since last year's Osmocosm to ask you, fantastic scientists, 2 simple questions. Can we please have them on the screen? While they're getting ready. Aha, there they are. All right. So, Petra, say hello, Osmocosm.
Hello.
Okay. Sol, say hello, Osmocosm.
Hi.
Okay, Petra, go and ask these scientists, artists, engineers, lawyers, and financial people. Ask them your question, please.
Why do some people have nose hair? Why do people have hair? Bye.
Why do some people have nose hair? Notice some people. Sol, ask your question.
What? I can ask it again.
It's your turn. Ask your question.
Why do people have hair?
Excellent. So the 2 questions that you need to consider is why do some people have nose hair, and why do people have hair? Okay. Thank you very much, kids. Bye. All right. And now we can get on with our keynote speaker. Again, it is my distinct pleasure, absolute privilege, and honor to introduce to you Dr. Claire Guest. Please, Claire, take it away.
Okay, lovely. Well, thank you so much for that wonderful introduction, Andreas. As usual, you're just too kind. I think it's been my privilege to work with you and your teams and actually have somebody that, after many years of work and skepticism, really believed in the work that we were doing. So I'm just going to try and share my screen now, and hopefully you will see my PowerPoint slides. Brilliant. So before I start, I just wanted to very quickly pay tribute to our patron, who's now Queen Consort, and a day that Andreas and I remember well, when our patron, who was then Duchess of Cornwall, invited us to present to our then Queen Elizabeth, Her Royal Highness Queen Elizabeth II. So without the support and belief actually of the royal family, we'd have never have got this far. So I just wanted to pay tribute to her at this sad time. So I won't spend long on this, but we have 2 sides to our work. We have our medical detection dogs, we are biodetection, who detect the odour of disease by smelling a sample. So they never have direct contact with the patient. They're always sniffing a sample of breath or sweat or urine. And we also have a medical assistance dog programme where our dogs are actually working side by side with an individual who has a acute medical condition. So a really good example of what Andreas was saying about, how things change and moving from the dog to technology. Actually, our early work was done in diabetes detection. These dogs are able to smell blood sugars when they go out of range. But actually now the technology has taken over, because now we have these continuous glucose monitors and ability to scan our glucose levels from using our phone device. So that's an example of how, you know, technology has changed the situation for somebody with a chronic health condition. We're looking at what we train dogs to detect in relation to sniffing samples. This is a summary of what we've trained so far. And I've been asked today to focus on our learnings of the detection of COVID-19. Everybody's bored of COVID-19, I know, but actually this is quite an exciting aspect to it. And I think we have learned so much about the first opportunity we've had to train dogs to detect a human virus. It got huge media and government interest to start with. The UK government at the beginning of the pandemic were really interested in the dog's ability to detect reliably the odour of the virus or somebody carrying the virus, even if they were asymptomatic or pre-symptomatic. Now, this meant that they did actually support some of our work financially, but unfortunately, by the time or fortunately, I should say, by the time we started to get some good results, the UK government's focus had become vaccination, because obviously by that time there were some successful vaccine programs. And so this work sadly fell into the sort of the back burner. But what we have learned that could help early detection through odour detection in the future has been absolutely outstanding. So we had 3 phases. We wanted to find out, firstly, has COVID-19 a distinct odour? Can dogs be trained to find it? And if it has, how could we actually transition this to an ability for dogs to detect the odour on individuals in environments where perhaps they had people moving in, either entering a country or entering an event. We had very detailed collection of odour samples, and actually we've had 3 prongs to this work. So very like the work that MDD was privileged to do with Andreas and team, we had a collaborator in the UK that actually was looking at the VOC analysis at the same time that the dogs were indicating that there was an odour to find. And we're also working together to look at mathematical modelling to see how effective actually the dog in this situation could be. So a large number of participants were recruited, over 3,000, and we collected socks, face masks and T-shirts with balanced demographics. So this is the super sniffer team, and they were trained to detect the odour, and we mainly used for these dogs, or only actually for the second phase, we used a pop sock. The reason for this is that we have over the years found out that these pop socks are very, very good at capturing odour. The foot's good at releasing odour, and that the odour is very easy to present to the dogs and maintains a good odour release for some time. So these were the dogs, and for their double blind, they looked at 200 positive, 200 negative, and of course everything was completely randomised and unknown to anybody in the room. I'll just show you quickly a video of a dog working. So this is a dog working, and I believe in this particular lineup, the sock with COVID is in position 3. All the other socks are from people who've worn them for an equal length of time. Some of them have cold symptoms, but none of them had COVID-19. So if you can watch the dog's ability to do this, not only the dog's ability, but how much actually the dog enjoys doing this. So very quick sniff required to make this the detection, and then that's the dog's indication that she has found the odour of COVID-19, which I have to say, I'm going to talk about this a little bit more. The initial variant was very smelly. Dogs were finding it very reliably. And in fact, in double blind, these were the results we got. Now, for these results, we were looking at the PCR as being our gold standard. So the dogs were measured against PCR, but in analysis, there was a clear indication that the dogs were considerably better than the rapid test, the lateral flow test that people often were relying on. And of course, you see the best dog there was over 94% sensitive in detection from a sock that had been worn in many instances, had been worn several months ago by somebody who was either asymptomatic or mildly symptomatic, but not somebody who had serious symptoms or was in hospital. So where do we want to take this? Well, as I said, for this model, we wanted to look at history of dogs and the way they've worked. You know, they've worked in airports and other environments, screening people rapidly for drugs and explosives. And we wanted to see whether the dogs could do this. So we started to transfer the dogs to searching people, looking for objects of clothing that had been worn by somebody that had the disease, had the virus. So in this particular instance, you'll see what's called a passive screen, meaning that the dog is simply walking past the individual, sniffing. And I think it's the third or fourth person, but you'll see clearly who actually has got the virus. Actually, she hasn't got the virus, sorry. She's wearing a T-shirt or shirt that was worn by somebody who did have the virus a few weeks earlier. So you see everybody's got shirts on, but that's the shirt there that was worn by somebody who had the virus. So a nice clear indication. So we got really excited about this. We were really hoping that at this stage that we'd get our dogs out into many, many places and many environments to screen. But as I said, the government's change in terms of its support for getting dogs into big public places waned as the vaccine program was rolled out. And actually, I don't know what it's like in other parts of the world, but in the UK, the sort of guidelines in relation to COVID infection have been virtually dropped. So it's obviously to get support for this continued work has been quite difficult. But we have learned some incredible things. And one of the things is if you are working with a virus, as we know, the virus mutates quite rapidly and it has mutated probably up to 35 or more times already. Now, one question, you know, does a mutation in a virus cause a difference in the odor signature? Well, actually, it does seem to change the odor slightly. The interesting thing, of course, is that first COVID virus was making people very, very unwell, but wasn't quite so contagious. As the virus mutated to a more contagious but less lethal virus, the effects on the body became less, and this does seem to reduce the odor signature, the odor pattern that the virus has produced. We struggled because in the first phase of COVID, we wanted to get out to transfer the dogs from shirts that had been worn to people who'd really got the virus. Now, of course, this was incredibly difficult because we were restricted. We weren't allowed, people with COVID weren't allowed out of the houses. So we could only screen in their gardens wearing PPE. But this just shows you the same dog working on somebody who really has got COVID. So in this particular case, the lady in position 3 has got COVID. The other 2 are healthy individuals. So you can see for the first variants, these Omicron variants, again, the odor is very, very obvious. And the dog is able to make a very quick detection that that person has got COVID. We know dogs can be highly effective, and they could be highly effective in averting transmission. They were detecting low viral loads. And we were looking at modeling of dogs basically triaging, so picking out, you know, if hundreds of individuals walk past, picking out those individuals that had the COVID odor, and then they could then be followed up by PCR LFT, but it would mean that the population that required the test that took longer could be greatly reduced by the dog being able to triage in this way. So this could be used in many situations. You've got large numbers of people entering places quickly. As you saw how quickly the dogs are. The dogs actually also may serve as a visual deterrent. You know, whenever you've got dogs, people may, certainly when we have the work we have done, and we've done work in some private sector places where perhaps contractors are coming on site and they don't want to introduce the virus into people working underground in other places. You find that having dogs present makes people much more careful about doing their tests appropriately before they arrive. So what's next? Well, you can either screen people on stands, as we saw. You could do this passive screening, or you could do a form of indirect screening where people perhaps stand behind the screen and the dogs are targeted to sniff a particular part of the body, probably the hand or the wrist. And this is still work in progress. But we have found working with virus has been very complex, say partly because you need to continually procure samples from the new variant in order to keep the dogs up to date, if you like, and keeping them generalized onto new odors. In the UK, we had very limited access to real COVID in the early days, and this did result in the dogs having downtime when we're waiting for new variant to come in so the dogs could be trained. And if you're not careful, you do develop odour tags during training. So if everybody hands their clothing in and is given a t-shirt to wear, the dogs start to look for cotton as well. I don't know really have the same problem with your electronic noses, but dogs, because they've got their brain, start to realise that if most odour on COVID is collected on cotton, then they start looking for cotton first, which of course is a big problem in your training. The other really interesting point is as the virus went on, we had to start relying on lateral flow, the rapid test, because people stopped PCRing. And what we then found is that the dogs would say that some people that had been given a lateral flow test and were positive at lateral flow did not, in their odour pattern, did not smell of COVID. And if I show you run one, this dog here, somebody's just had a lateral flow test on day one, and its lateral flows come back positive, but this dog does not believe that the person has COVID. So there's no indication at all on any of those people. As far as the handler of the dog concerned, nobody there is positive. Now, of course, lateral flow tests have got a big false positive, false negative themselves. So who's right, the dog or the test? You have to wait to find out. In this particular case, this is somebody who's got an LFT and they're on day 4 and their LFT is positive again. And you can see the difference in the dog. Now, the dog in this case is absolutely sure that the person in position 2 has definitely got that odour. So much to understand. Is the odour different? Is the LFT wrong? This is where it becomes very, very complex. Thank you. So in addition to this, we also work with our collaborators who are looking at the biomarkers that they could see, the VOCs that they could see that might be valuable to make electronic detectors in the future. And what they did find was that COVID, or certainly the early variants of COVID, did seem to have were significantly different from negatives, and that there's certainly more work to do here in developing perhaps virus detectors for the future that could be rapidly deployed. And that, of course, is the nature of the virus game. That's what we've learned. Unless you can change rapidly, the virus is always one step ahead of you. And this is why, you know, this learning has been so valuable to us. Again, some more analysis showing principal components with the early variants and negative controls. So how can we help now? Well, before I finish, I just want to quickly show you something I showed last year. Is, you know, we realise, as Andreas has said, you know, it isn't all about the dog. The dog cannot do all this work. The dog could never be thousands of dogs in laboratories all over the world waiting to sniff samples. It's certainly not my vision, and it's not what the dog would want to do. But we can get more data from the dog. We can give the dog samples using interactive presentations that enable the dog to tell us how good an example of the odour this is. So, is this a really good example of COVID? Is this what I was trained on? Or is this getting weaker? And how can we do this? Well, we can do this by showing, I'm going to show you, this is actually a Parkinson's sample in position 3. The dog has been trained to push hard when he says not just it is the sample, but it's a good example of the sample. And this shows the readout that we're able to pick up. And this is how the dog's information can then be translated. So that's the Parkinson's sample. A lot of interaction with that stand. The interaction is then measured, and we can then see how good an example of Parkinson's that is. And here's the readouts that provide the data. So not only can we can provide data numbers by continually showing similar samples to a dog, but we can also start taking readouts like this. And I think there's a lot of potential for this type of work in the future to assist in the building of electronic devices, or actually teaching your electronic devices what odour pattern the dog is using in order to make his decision. And in this case, there was no Parkinson's at all. So you see you're getting very similar readouts. So that's work that we're hoping to develop more in the future and looking for funding. So My hero from my childhood, Captain Kirk, and of course Andreas, the real Captain Kirk in my life. And this is Florin sniffing the electronic nose there, or the that Andreas and his team have developed. So the hope is that Florin will teach through her knowledge, and her dog brain will transfer that knowledge to an artificial intelligence device that can then take over from the dog's understanding of disease detection for cancers, and lead to something that can be used much more broadly and widely, and save millions of people around the world. And before I finish, I just thought you might like to see this. Now, this is what we do. I'm really hoping this is going to play. This is what we do in our day, in our work, with our one-to-ones. And this
Olive was quite miserable. I couldn't go out on my own. I couldn't tie my own shoelaces. It was that bad. I just sort of lost confidence in life. I felt like I was missing out on normal, everyday situations for years. So I heard about MDD because I knew someone else who had a dog from another AD UK charity. I went on to the AD UK website, and that's where I saw MDD. In the February of 2019, I came down for a handling day, and that's where I met Olive for the first time. She was the first dog to come in the room, and I remember they said, "Oh, here you go, so you can handle Olive," and I was a bit like, "Oh, okay," like a bit nervous because this is the first time encountering a dog. I remember the trainer actually saying to my dad that she was walking better with me than she was her socializer. We got back in the car and I sort of cried on the way back to the centre because I was just so overwhelmed with sort of excitement and hope for the future. I just remember how comfortable she made me feel. I didn't have any sort of anxiety about being out in public, and it was sort of this wave of relief kind of came over me. When we're out and about, her stance kind of changes. She'll kind of start walking in front of me and trying to sort of get my attention a bit. And then it sort of gives me about 5 minutes to go and lie down somewhere safely before I lose consciousness. My life is amazing since having Olive. And I'm just so happy. I've never been happier. She's just changed my life. I've been in shocks on my own. I was sort of quite isolated before, and I've made new friends with another partnership from MDD, and I've been able to sort of partake in my hobbies again. Just thank you for changing my life.
So I'd just like to say that lady has a condition called POTS. At the moment, there is no mobile technology that can tell that lady that she's going to have her unconscious episodes, which she has between anything up to 20 times a day. So she'd have to be rigged up to heart rate monitors, blood pressure monitors, oxygen measure, everything to give a pre-warning. Her dog does it by using its sense of smell and gives her a 3 to 5 minute warning. We have a huge waiting list for these dogs. And I think one thing that you do see in that video is actually the electronic sensor is the way forward for detection of many diseases, but actually the dog's unprecedented love and companionship is also what's changed that lovely lady's life. So we've got some challenges ahead. We've got to change the canine biosensor, for which we now have robust evidence, into application so that we can apply what we know for maximum impact and scale up what we know is going to be a way in which we can save many lives in the future. And as Andrea said, Daisy's gift to me was that she saved my life, and Daisy's gift and her fellow dog's gift to humanity is to further understand and use this incredible ability to detect disease through odour. So thank you very much.
Thank you, Claire. What a wonderful lecture. I'm sure there's many people with questions. Here's a microphone also. There's microphones out there. I'd like to ask a question. First of all, thank you, Claire, for correcting me. The video I showed, Claire correctly said it's Parkinson's. I made a mistake. I said it was prostate cancer. And Claire, you showed that this in the video of the dog pushing down on the sensor, on the pressure pads, that you are able to titrate essentially the interest of the dog, and you're asking the dog, tell me what is a better sample. I think that's really brilliant. You've basically closed the feedback loop, and the dog is now explaining to you what is a good teaching aid. It's like asking my kids, oh, do you like this type of approach to the math or the reading, or this? Which book do you prefer to learn from? And the dog can tell us. Now, my challenge from you, Claire, is now I'm going to make my machine do this, because I didn't realize you can do this. We are going to train the trained artificial dog intelligence to train itself, again, inspired by Claire's work. So, Claire, I'd like to for, one day you and me will sit down and you'll explain to me exactly how you train the dog to tell you the salience of the sample. But can you give us a little hint here? I'm sure it's not that easy, but how did you train the dog to tell you whether it likes the training tool?
Actually, we in biology use a bit of frustration. So if a system knows something is right and you withhold reward when it knows it's right, it gets slightly frustrated, and that behavioral response is what we measure. Okay,
let me get this straight. If you withhold the reward, the dog gets frustrated.
Right. Yeah, because if you know you're right, you watch your kids. If they know they're right, they've given you the right answer to something, and they know they're going to get the reward. Like, come on, where's our reward? We know we're right. And you use that behavioural response as a sort of to ask the dog to give you more of the same. So tell me then, are you right? Yes, this is it. Just basically building a sort of frustration that the dog.
So that gives you a measure of their certainty, right? If they're really frustrated, is that why in that video the handler kind of delays the click?
Yes.
And the dog's like, oh my God, that is so clever. Did you notice how the click is delayed and the dog's like, come on, I already showed you, here's a third push. Now, are you telling me that if the dog was not too happy with the sample, even if it was a positive, the dog would not have done that third push?
It would move away because it would.
That is so clever.
It would think that withholding this reward is basically confirming that it was wrong, and in that case, that's why you're using the dog. The dog's saying, "I know I'm right. I know I'm right. I know I'm right." So you build it to start with, and young dogs you build it gradually, because obviously if you push too far, then they become confused. But once the dog knows his job, the dog will just stick at it and say, "No, I'm not moving. You know, this is it. I want my reward." So that's what you use.
That is such a compelling story. I want the audience here to understand what Claire is doing is leading not only the dog research, but it's also leading the artificial dog intelligence research. We're learning from her how to train the artificial intelligences. And this is a trick I had not realized how powerful it is. Now, the challenge to Claire, this audience, myself, Stephen Fowler, if she's watching, Sentient, the startup that is caused by all this, is what is the analog to dog frustration in artificial intelligence? How do we frustrate a computer? How do we make it a little upset, a little angry? I love it, Claire. Thank you so much. So go ahead. I think Dimitri was first. Go with your question. Yeah. We have a question from Dimitri.
Yes. Hi, Claire. This is Dimitri. The question I have is this. Based on the videos that I've seen, it seems that the dog uses the nasal cavity to smell. Is that the only thing? Or is there something else that the dog senses from your experience? Is it the aura of the person? Is it the behavioral thing? Is it something more, or just the nasal cavity? And if there's something more, then how do we incorporate that into the artificial nose that Andreas is creating?
Very, very good question, Dimitri. Very good. So I would say, the partnership that you saw together, Faye and Olive, we trained only on Faye's odor. And the very first drop attack that they had was after they'd met, was in a garden centre, and the dog did give a partial alert to that very first drop. So clearly something in that odour that we collected through these drop attacks, the dog was recognising. But it's a really interesting thing because, of course, as that bond gets stronger between the dog and the person, the dog does start, I'm sure, to use other things as well, which help to predict to the dog that something's going to happen next. It's difficult, isn't it? Because it's taken me so long and so many years to reduce the level of skepticism in discussion of odor detection. I feel that, you know, the world isn't quite ready to start saying, well, perhaps there's something else as well. Perhaps there's some change in you know, the energy around the body or something that the dog is also using. In my lifetime, I suspect that won't be validated, but it wouldn't surprise me in future lifetimes that we start to realise that when we become unwell, I know Andreas, you know, we've spoken about this, that it may change the sort of energy around us, and that may well also be detectable by sensors or even dogs. But yes, at the moment, what we train on is an odour that the dog will use either through his olfactory epithelium or the organ of Jacqueson, or a bit of both. But certainly I believe there is more that goes on. To be honest, when we go to places like Crofts, there could be, well, there are thousands of dogs and thousands of people. And yet the dog's detection rate for that disease does not change. Now, the odour patterns must be like incredible. But the dog's ability to make that detection of that is odorless remains. So that in a way is quite telling, that I think there must be something really driving that detection that gives that dog that ability to be so reliable.
Yeah, wonderful. Carolina, you have a question?
Yes, I have a question from our audience online. So Dr. Katie Whitcroft asks, how do we decide who gets a dog?
Yeah. How do we decide who gets the dog? How does MDD assign the dogs?
Yeah. At the moment, because we have such a long waiting list for our detective dogs, our medical assistance dogs, we have to go on how severe their condition is. So somebody like Faye she had to use a wheelchair prior to having a dog, and she was unable to go anywhere on her own because she had multiple injuries that she kept on fracturing and having regular hospital admission. So we would measure all those things, but also, of course, we're also looking for somebody that we believe would like this sort of furry waggy tail version of a biosensor, because of course the other part of what those dogs do bring is confidence and companionship.
Thank you.
Yeah. Do you have time for? Oh yeah, Ilya, go ahead. There's a question.
Hi Claire, thank you for your talk. I was just wondering if I heard you correctly, you mentioned that you have to retrain, or you had to retrain the dogs with new variants. So I was just wondering if you can speculate kind of how, like, what they're actually detecting that's making it so that new variants, which presumably have very similar pathologies, are actually requiring you to to have to retrain the dogs. Thank you.
It's a really good question. I think part of the difficulty is, there's something that all individuals doing diagnostic work understands, is that it's always that balance, isn't it, between sensitivity and specificity. So in the early work, the guidelines were that the dogs had to be highly sensitive. So they wanted the dogs to ignore any other respiratory disease, flu, cold, anything like that, any other coronavirus, anything. So we made the dogs highly specific. Now, this is what, of course, with dogs you can do with training. We made them highly sensitive. And so they'd pick out what was at the time Omicron. I'm sorry, not Omicron, it was the Delta story. And then they would be taught to ignore things that were similar but not the same. Now, because of that, when you then add another virus or add another variant, the dog then says, well, this is a bit like it, but actually I've been told, not to alert unless it's exactly this. So you have to sort of add the new one on and say, actually, now I want you to alert to this as well and alert to that as well. What we were seeing, and it'd be great actually, we could talk about it for hours, but what we're seeing is, as you start to do that, so as you start to say to the dog, Okay, I don't want you just to indicate to the first variant and the Delta variant. I also want you to Omicron. The dog's specificity seems to drop a bit, so it starts picking out other people who have got other symptoms. Now, the difficulty, or respiratory symptoms, the difficulty we had was by the time the dog started to do that, we were relying on LFT. And LFT is so unreliable itself that we then started to get this muddy picture. So we weren't quite sure whether the dogs were actually still correct, and it was the LFT that wasn't correct, or whether or not the dogs were just generalizing to the point where they were starting to generalize to, okay, you've got some respiratory problem that's causing you to have an inflammatory response, and all the other responses that, you know, that viral responses produce. So it's a difficult one. Is it that, you know, it's a difficult one to know. If you want the dog to be highly sensitive, then what is it that the dog's using? No doubt it's, you know, the inflammatory response markers plus. But if you ask him to generalize too much, he will generalize down and say this person's sick. You know, they've got a respiratory. So I think we'll understand a lot more. I mean, the COVID virus, as I said, has been one step ahead all the time, you know, and I think there's still some learnings to be done.
Thank you.
Do I have time for a last question? Yes. Can you hear me well? Yeah, this is very inspiring. Thank you very much. Somehow a related question. So you were able to publish some molecules, so biomarkers, right? I guess they are related to body odors or to sweat. Do you know more about the relationship between COVID infection and the emission of those odors?
So I don't know if I know the question. So those biomarkers were done on exactly the same samples that the dogs sniffed. So what we don't know, because unfortunately we haven't had the funding, is to know whether you repeated now with, say, Omicron and on, whether the biomarkers through that analysis would vary as well. Unfortunately, we haven't had the funding to be able to do that, because there's sort of now there's no interest in COVID. So whether the biomarkers that would be seen if we repeated that process again with the mass spectrometry, I guess chromatography would be different. I'm not sure how much they would have varied. Is that what you're asking me?
Yes, absolutely. Thank you very much. Thank you.
All right. Unless we have other questions, let's thank our speaker again. Thank you so much, Claire. And